Hi everyone, I'm Dean Moore, CEO and founder of My Health Record, and today I have the pleasure of sitting down through this podcast with our two Russes, as they're known in our organisation, Russell Lewis and Russell Hobson, who both head up engineering. Nice to have you here today, guys.
Thank you.
Thanks for having us.
Typically, guys involved in tech don't love to chat, but we've managed to get them in front of the mic today, so we thought we're going to drill them with a few questions and try and get some insights into what happens in the background of My Health Record, how they manage data, how they're using AI, and everything in between that. So maybe we'll start with Russell Lewis. Russ, just tell us a bit about yourself.
Sure. So software developer background, now in management obviously. Still like to do some software work when I can. But generally now building out the platform, understanding what the platform's about. I've architected most of the platform in the beginning. So just riding the train here and keeping along and trying to do the best we can, putting our best foot forward.
I think you're a lot more than that. I've known you for a lot longer than probably about 15 years, if I'm correct, maybe 20.
Yes, yes, it's been a long time.
Watched your career come a long way from building many systems for many organisations, and I think we've been lucky enough to have you around. Russ Hobson, Russell number 2 or number 1, however we want to refer
Other
to
Russ.
it. The other Russ.
Other Russ. I'm not quite as long at My Health Record. I've been around for between 2 and 3 years. I think I was lucky enough to join the company when the journey really started to take off from we've got a product that we got to market, we've been running enough to know what it does, and now we're going to take the next step to make it scale, highly available, and take a different look at security and things like that. So I've been part of that journey, which has been fantastic. Learned a lot and really enjoyed it.
All right, now before we proceed, to make everyone's life easier that's listening to this podcast today, we've got 2 Russells. I don't want to confuse them online.
Sure.
So should we refer to them as Lewis and Hobson? Or
sure.
Russ 1 and Russ 2? Or
just let's do
Big
surnames.
Bear, Little Bear, what do we want to do?
Surnames are fine. Let's
Surnames.
do
All right.
R1 and R2 is the other option.
Okay, let's do that. So there's a lot to talk about today in what we've created in trying to create a system that brings all the data into one system for organisations to enable them to understand it more. So I think we'll dive into AI at one point. We'll talk about data classification, what risks are you seeing, and maybe we'll start with that. We decided to design and build My Health Record because we saw a huge gap in the market where providers were providing systems to large organisations. Every provider sort of seemed to have their own system. Data was everywhere. It was spread across computers, databases, and organisations didn't have the ability to be able to bring it into one place to ultimately do what they're probably trying to do, which is reduce risk and understand their data. When you look at the existing systems that are out there in the marketplace, and Lewis, we'll start with you. What are you seeing that isn't really meeting standards today, and the risk for organisations that exist out there?
Well, I think there's risk everywhere, and that's, you're never going to get rid of risk is probably the key point to that, is that risk exists everywhere. The only thing you can do is manage it. So I think from our perspective, we've spent a lot of time on developing out things to manage that risk and understand it, and understanding it is 90% of getting there to sorting it.
So let me just ask, I remember with an archaic system we used to use, pre-employments, information was being shared via email.
Yeah.
And I know that has been a topic of conversation early days for us. So
yeah, I think from the beginning of the platform, we made a conscious decision to not do that. And that was based on a lot of things, is that it's medical data. We were looking to basically pull people into the platform where it's secure and kept properly to make sure that it was being viewed by the right people. So if it happened that an email went to someone that they shouldn't have, it didn't matter, because really they couldn't get into the platform as that user and see it anyway. So you're exposing or breaching a minimal amount of information by keeping that document internally and not having the ability for someone to just throw it around in an email system. And there was a conscious decision. I think we had some clients not happy about it, but I think once we went down and explained why, they didn't have a problem. It was almost instantly dropped because they understood the benefit of doing this kind of thing. And I think that's what's important, is as much as we can build in these things to mitigate risk, it's that education piece that comes along with it, with your clients, that makes it better.
Yeah, and I think about, there was the big, was it the Optus, the Medibank scandal that occurred, sharing of information and protecting it's just become so critical. Hobbs, your view on what you've seen in systems in the past and the risks associated with what they've done and what we're trying to mitigate at My Health Record. Any ideas?
Completely agree with other us here in that most of the exposure you get from people. And that's, we're ultimately building systems that serve people, so we're always going to have people, but they tend to be the weakest link. So there'll be things that you do in error, data you save somewhere you shouldn't, an email that you send to somebody you accidentally put in the to field that you didn't mean to, and that kind of stuff. That's where we really have the most risk. So Russ is right. We did things early on, like say, we're only going to share links to a platform that requires authentication. So if you get the wrong email, you still need some credentials to get in and see the data. But the other thing is, for us, because we move pretty quick in terms of software development, we've got to make sure that our processes in dev are really, really clean. So we don't use any production data to do testing. We always seed data that we've manufactured. So we don't take data from one system and seed it into another so we can see what happens. We always create that data from scratch, so it's never referring to anybody real. The other thing is, we always clean up after ourselves when we're doing testing in new environments. So some of those things come down to literally third-party developers leaving a database file in a publicly accessible spot on the internet. So you have to be really good at cleaning up after yourself and managing the protocols that help you keep those things really tight.
Got around that.
So we're probably lucky in some degrees because it's our own proprietary system. We store the data, we keep and classify the information. So we don't really leverage too many third parties to access that information at all. So we keep it locked under key and they don't have the rights to see it. So we do share that responsibility with our provider, our cloud provider, but other than that, we are the only people that would have access to that information or data. So unlike other businesses that involve large other companies to then maybe mine their information or look at it, we're doing all that internally, so we have heaps less risk there.
Okay.
The other thing I think we do is we approach all of our certifications in a way where we try to walk the walk before we talk the talk, so to speak. So for example, with our ISO certifications or with any of the other assessments we've had that turn out really positively on the whole.
So we clearly have to dive into AI and we're going to, and I'm actually interested in, I want to make sure we come back to understanding how we manage AI in a world when we're talking about, data breaches, this sort of world of bringing information and connecting to our systems. Let's just start with, I know you were at a conference recently. The conference was?
Australian Information Security Association.
And so that was where?
In Canberra.
Okay. Do you want to, what were the highlights? What were you hearing on the ground from a security point of view around AI and other areas?
Yeah, I think we both got different things out of it, which is nice. For me, I guess the thing that stood out to me most was really obvious in the marketplace at the conference. So there was a lot of talks about this, but it was really prevalent in the different products people were showing. Threat assessment now threat assessment used to be having a look at all the hacks that are out there, quantifying them and classifying them, and then telling everybody, here's this hack, here's how you're exposed, you're using this software and that's exposed to it or it isn't. Now there are so many vectors, so many threat positions you can take that you have to defend against. The way to detect them now is to aggregate and look for patterns. So we're using AI now to detect threats rather than trying to catalogue known threats. That's how AI is evolving in the space of cybersecurity.
Good comparison there. The human body probably has viruses rolling around it all day long. We actually know it does, and the human body is fantastic at attacking them. So is our software effectively, if there are that many threats out there, are they coming every day and we're going, we're blocking them?
Absolutely they are, no doubt, yes. And we have lots of safeguards in place for that kind of thing. So as much as AI was looking for those vulnerabilities in your systems, underpinning it was a manual process of somebody building a database of all the vulnerabilities that exist out there. So it's never going to be totally AI. And frankly, my point to that is that I think in this space specifically, people are maybe getting a little too comfortable with AI and that they're losing that personal aspect of actually finding vulnerabilities or problems in their ecosystem and relying on the AI to do it. And as much as we can rely on AI for lots of things, there's a chance that it may not get right. So how do you mitigate that? That's a human, and that humans are okay. We need to use a mixture of both, I think, is what I'm trying to get at. And rather than just relying purely on AI, there needs to be a human involved to make sure it works properly, and I think that will never go away.
Because humans don't make mistakes, right?
Well, they make
We're doing a
different.
great
Yes,
job
they
with
make
this
much
planet,
better
aren't we?
mistakes than AIs.
So if we just come back to the platform itself, how are you know, if the core of the platform is bringing together data points on human health, occupational health is enormous. We talk about periodic testing, pre-employment testing, understanding individuals as they're getting injured in workplaces, even management of them after. We'll bring all those data points into one place. How do you see AI developing to be able to use that data and the impact that that data will have in years to come for organisations to mitigate risk, lower premiums, less injuries in the workplace? Who wants to take this? Hobbs, Lewis, Hobbs?
Well, I can start.
Sure.
Sorry. I think there's an important distinction to make between artificial intelligence and machine learning at that juncture, because most of what we know about health that we learn through algorithms comes from machine learning rather than AI. So maybe just to explain that a little bit, machine learning is really what we understand really, well as a sort of more classically statistical approach to data, where you can do things like group similar data together, find points of sort of digression from each one that you didn't notice up front. Now, contrasting that, artificial intelligence, I see as something which is more around, something which is really good at creating meaning out of a human system like language or code or something like that. Knows how to string things together to make it convincing. So a human-machine interaction. If the machine can divine what your sentiment is based on what you give it and then know how to respond, that's absolutely fantastic. But that's not clustering and it's not statistical analyses. If you want to get to really, really useful insights into health data, typically you're falling back to machine learning. I think there's a whole part of that which is driven by AI, which we just don't see yet.
I feel like every day I open up LinkedIn on my phone and I'm reading more about AI, and it is literally consuming our lives on every front, to the point that it can do everything. That's the general sense I'm getting. Like, there is no problem in this world it's not going to be able to solve in due course, and how it's going to change us. You agree?
Yeah, I think to some degree I agree. I think that AI is really good at what it does, but is it really good at looking at a bunch of data and actually figuring things out? It's not. It's not really good at that. Like, that's why we fall back on these machine learning techniques and databases and all kinds of things, because they're much better at classifying information and then reporting on it or amalgamating it together into all kinds of different ways. Whereas an AI model needs to have that context in its head for it to figure it out. And how much can you put in its head before it overloads it and it can't do it anymore?
Do we know that answer yet?
You need to train your own model for that. But it's only going to be good at, like, if you told it to write a story about your health life based on the information it had, it could do that. But if you told it to say, give me an idea of what's going on here and how that works with that, it's not good at that because it doesn't have the context to support it.
But it will.
So
Is that our
eventually, as the models build themselves and we can train them better, you'll be doing bespoke models for what you want. And I think that we're preparing our software to get to that by classifying the data.
I want to bring it back a sec, right? So one of the things that I keep talking to organisations about is, if you want to prepare for the future, you've actually got to, one, have your data, then you've got to be able to understand it, and it's got to be well laid out to be able to be understood. Right? That's in my learnings to date and working with you two for a few years. It's got to be a table with all the data points so that we can actually use that data well into the future. Most organisations don't have that. My Health Record is there doing that right now. It's bringing not flat files like PDFs into uploading like into a Dropbox scenario, but literally grabbing data, be it off a written document, off a form or a PDF, or literally when a health professional is directly putting it into the software. And then it's putting it into this huge, I call it like Excel spreadsheet that's three-dimensional in many different ways.
That helps your mind.
Tables,
yeah, go for it.
and it's putting all these data bits out there. So I've got this view that if you want to start planning for the future, you've got to start doing that. Why? Because the one thing that organisations want is they are trying to mitigate risk. They're trying to improve safety. They're trying to have healthier workers work in their workforce. Is it viable for me to say that in years to come, if your data is well collected into a good database, that systems, AI, whatever it might be, will be able to then predict health problems into the future based on the things we've learned, language models, over years. So if my blood pressure is at this level and I've got back pain and I've had a heart test at this point or I had a drug test at this point, and once we know enough about medicine, those 5 things, when they come to a certain point, put you at a risk of a stroke. Is that viable?
I think you break it into 2 parts, right? So part of that is machine learning to get that right. And the other part, if you want to focus on the AI side, would be the ingesting those documents. You know, using AI to get that information in a format that you can then teach something how to use it properly. And I think that's where there's a lot of power up front for what we do, because we know out there's lots of doctors, lots of people that put things on paper or don't feel, that's handwritten, or it's, pages and pages of spirometry tests, for instance, or something like that, where it's a lot of information bucketed away in a box in a corner. And I think having the ability to pull that in is your first step. That's your stepping stone to getting that. Once you've got the data in there, then you can look and understand about how you're going to use that or leverage the information you've got. But getting it in is a huge use case for AI, because it means we can have the AI understand the document, and because it's doing repetitive tasks, it just gets better at it. And we can teach it how to get better at it.
So one of the reasons we designed the system is because I've been in the world of occupational health services for 20 years before technology. And it frustrated me to no end to see that HR would be doing pre-employment medicals, and that data would be given back to HR, and they'd tick in their HR system, approved, hire the individual, and then we lost that data. It was gone. And then someone would present 3 weeks later at work and they'd have an injury, and the injury management team would then ask HR, why do we hire this person? Well, they were fit for the job, or we needed more truck drivers, whatever it might be. And there was no ability to bring data across all the components of the business and all the individuals that have responsibilities around health of employees, keeping them healthy. Presumably the way you've designed this database is to assist that and help that.
Yeah, look, and I would say that there's a lot of thinking that we do when we're designing a system to try and make future-proof it as much as we can. So data points that we collect is a really good example, where we may ingest a whole bunch of historical documents for a business that comes onto our platform, and the benefit of that immediately is that they get to track 30 years of paper records on their workforce. We can tie those to individuals. So you've digitised, but you haven't understood every single data point that's in those documents. You've just brought them in and you know that they're there. As we bring those documents in, you're right, we use AI to classify and give us annotations, tagging, some outcome information from any medical documents that we ingest. And we keep that in a catalogue that allows us to investigate further at a future time, right? So we know we just ingested, say, 10,000 spirometry documents. We know who they're for, and we've attached those appropriately to the right records. So some clinician can go and have a look at an employee and say, oh, there's their spiro result from paper from 10 years ago. Let's have a look at that. However, in the future, we might find that there's a bunch of data points in those documents that we ingested that have now become relevant. We talk a lot about silica in some of the industries that we deal with, and that's something which has become prevalent in the last number of years. But we could have been tracking information on that for 30 or 40 years, and perhaps that's locked away in those documents. So we try to catalogue those things and annotate them such that we know that the data's there, and we can come back and mine it later if we need to. Those are the types of things that we try to do to future-proof. But I think at the high level for your Occ Health and Safety rep at any kind of medium to large enterprise, knowing that those documents are digitised is part of it, but also knowing that the gold that you've got in those documents is somehow accessible and analysable in the future, that's another huge bit.
You mentioned before, Lewis, that there's an issue around accuracy, and that's why we have humans, and I told you how good humans are at making decisions and all these things. So how accurate right now is being able to strip data off a written, doctors have got the best handwriting in the world. We all know that, right? So being able to read their writing, get the data out of it, and have comfort that that data being collected is accurate.
Right, it's a tough question. We don't know the answer. We're still playing around to figure that out. The fact is, most of the time we can get the data in. What we're finding is more specialised models are much better at obtaining the information that you need. So if somebody's taken a model and then fine-tuned it to medical documents, it actually is much better at achieving what we want to get, or the goal we need of the data in there. Whereas if you just throw it at a standard sort of, something that just looks for characters and figures things out, it's never as good.
Right, so let me just understand that. So if I was to give you 1,000 spirometry tests, you'd probably go easy, because it's consistent, easy to understand and learn.
Correct.
But if I was to give you literally a filing cabinet of paper, and I was to put it on a scanner and say, here, we have no idea what's in this. We want you to tell us all the data points, the name of the person, everything.
Some's got one patient, some has a
That
list
could
of
be more
patients.
complicated. In this
We
still.
do that, and we would do that and leverage that to get the data in. We just want to store it against an employee so that when a doctor assesses them a year later, they can look at the note that the last guy left, which is great. Sometimes, unfortunately, the problem comes where we may receive documents that have been faxed, and the quality of those documents are low, and certain things throw out values. So we've seen before where we'll have a negative value appear as a positive value. Now, in a clinical world, that's a problem.
For the rest of the world, what does that even mean?
So if
You mean
you
there's a
scored
minus as opposed to a plus?
yeah, if you scored a Spiro a minus
Got it.
2.5,
Yeah.
it might just record it as a 2.5. Now that's in a clinical space, that's a huge problem because it's a big difference. But actually, we're working on technology that will identify those outliers and then bring it up front for somebody to manually look at, because it's outside of what's normal.
Okay, so current status for most organisations, they've got multiple providers, multiple systems, some doctors writing on paper that's coming in literally paper content file, it's going to a file cabinet, data's everywhere, pretty much no value, long-term thinking. Next stage, first port of call is let's get the data into one place. My Health Record is clearly providing a solution where, for the most part, doctors, health providers are putting the data directly into the system, but where not capable, we can ingest those files. Where they're standardised, we can read them. Where they're just a whole bunch of mishmash and doctor notes and different things, we can store them. But the advantage is, what you're saying is, in due course, as AI gets better, as learning gets better, which we know is happening literally by the second, then in due course that data's sitting there and it'll eventually just become all data points. And what used to be considered 30 years is potentially now a year. Like that's
And that's already changing, right?
Yeah.
So for example, as we ingest documents that might be from PDFs or hard copies, we already use different models to check if it's, what we can get out of a typed document versus a handwritten document. And a lot of that is around how do we ingest the data intelligently. So for example, using AI, large language models again, we can grab text that we used a different format for pulling out of a PDF. So we use a couple of different resources, typed, handwritten stuff, for getting good text out of the PDF. Then we have a schema of medical information that we know we want to match. We want a height, an age, we want some Spiro results, we want some auditory results. We can literally use an LLM to take our schema of medical info, what fields we want, and all the text we detected, and basically throw them at the wall and see what sticks.
Right.
Now, that is a pretty blunt approach, and we've been doing that for the last several months, where we've been fine-tuning our models to really get good at matching up what fields we want to pull out of the text we detected. But only in the last couple of weeks, we're starting to use some different models and some extensions on those to try to classify things in a more intelligent way. So we can do stuff like, give us the first name, last name, date of birth of the owner of this document, but also just what can you find in there that's interesting. And we might get a document summary that allows us to do things like present that to the clinician. So rather than having to go read through the whole document, they can get a good summary and say, well, that document doesn't look like it would interest me for this clinical purpose, but that one does.
Okay.
So that thing already shortcuts some of the stuff that we're, potentially wasting time for a human to review.
I think as we look ahead, I'm really interested in understanding what you're thinking about I mean, you're in tech, you're in health. I want to know why you like that sector. Maybe I'll start with you, Hobson. Like the intersection of those two things, and what are you liking about them?
The reason that I'm in health tech is because for me that's a very concrete thing to do. You know that you're impacting people because anything you can do in the health perspective is always going to impact. So combining that with something which is real world like health, to me that's what makes the most sense.
Yeah, I feel the same way, to be honest. There's not much deviation from that. I mean, it's working in health, I think, to me, it's a satisfying role because you know you're getting or benefiting people in the real world. And, you know, in tech, you don't often have that, you know. So I think having the ability to do things and create in a space that really does have an achievable outcome is amazing.
Okay, I've got a question for you. Why should organisations be looking at My Health Record as a product for the future? How about that?
Right. I think the core reason is that storage and amalgamation of health data, because I don't think it exists. And to be honest, that to me is the core of our product, is that we have the ability to store and manage all your health information across your employees. And that is key to getting a healthy workforce. And I can't see any reason or any other product out in the market that does it the way we do it. Because we link in the providers' documents, information, everything is directly back into your system. This is unheard of. Every provider has their own system, and when you leave, they hand you a big box and say, thank you very much. We don't have that problem. You could swap providers overnight and they will continue to run, see all the information the last provider's left. I think that's a game changer.
Okay, Hobson?
Similar, I think the health of your employees is, it's really an economic question, right? And you and I have talked about this a bit before. People are an economic reality for a company, even though things like employee health, especially day-to-day health, whether it's mental health or physical health, those things tend to become just part of what you're, as an employer, that you see as just the natural drag on your company and your bottom line. It costs to have people around, it costs to build systems with people and so forth. However, when you look at how productivity can be affected by people just being healthy or just feeling confident in their workplace that they're not going to have any kind of injury risk or anything like that, whether it's psychosocial or physical or some sort of combination. I think those things have huge impact on productivity and bottom line for a company. The costs of employee health are immediately impactful to your business and often disappear because, like you say, change providers and you lose that entire history of an employee. So I think what we're working towards is to really help companies recognise the true cost benefit of employee health by keeping that in one spot.
And we always talk about, you know, ultimately reducing LTIs across an industry, bringing premiums down. Guys, I want to say a massive thank you for today. You're the most eloquent techies that I've ever met, which is why we've thrown you in front of the microphone and cameras. And I really appreciate your time, and until next time.
Thank you for having us.
Thanks, pleasure.